News.
Treating breast cancer can be half the battle. As part of Breast Cancer Awareness Month, we're taking a look at the Survivorship program at UnityPoint Health. And Jennifer Carr, a nurse practitioner with the Trinity Cancer Center, is here to explain the importance of, I guess you could call it, aftercare.
Yes.
Thanks for coming in.
Thank you.
So tell us, what is the Survivorship program?
Well, first of all, the term survivorship actually encompasses breast cancer from diagnosis through the rest of their life. Once you complete treatment, there's a lot of effects that people don't often talk about. Financial issues, psychosocial, anxiety, depression, and treatment side effects.
Yeah. So how does Trinity Cancer Center address some of these issues? How do you help patients kind of get past all of that?
So the nurse navigators at the breast center and myself put together a treatment summary and care plan for each individual patient. So it'll review everything that they have gone through for their breast cancer treatment, and then the plan for surveillance moving forward. So that means follow-up appointments, imaging schedules, and any other issues that they may have.
How do you help with the psychological part of it? One, they've had, you know, maybe some damaging or aggressive surgery that they maybe are struggling with, and lots of emotional concerns. How do you address that? So
that is a big part of the survivorship program. We will connect people with resources in the community for counseling or medication therapy. And it is important to know that there are support groups throughout the community. Gilda's Club is one of them, where they can have that community of people who have gone through similar things.
Yeah, because I think that there's also frustration that you've had this treatment, but now my life isn't what it used to be.
Right.
You know, you may have things that you didn't have before and things like that. So those support groups can help. You mentioned financial, though. How do you help in that way?
So financial is probably one of the biggest concerns that people have when going through cancer treatment. We do at UnityPoint have a patient financial coordinator and counselors to help them navigate that. And there are also programs in the community like the Breast and Cervical Program of Illinois that will help underinsured or uninsured patients.
And there's also this trying to get back to normal. How can you help logistically with people transition?
So that is one of the more difficult things. I think part of the survivorship program, managing all of their follow-up and surveillance, so that's a piece of the puzzle that they're not having to worry about, helps them feel like their life is maybe getting back to normal.
Yeah. So it sounds like a great program and something that we don't think about. How can people access this?
They just need to contact the UnityPoint Cancer Center or the UnityPoint Breast Center. I'm happy to help anybody who's gone through breast cancer with any kind of issues that they may have.
So does anybody who's gone through this qualify? Does insurance cover it?
Yes, insurance will cover it. We will work through any insurance issues if you have them, but I'm happy to see anybody, of course.
All right, Jennifer Carr with UnityPoint Health. Thank you so much for telling us about this survivorship program.
You're welcome.